Let's speak now to Benjamin Neuman. He's a professor and chair of biological sciences at the Texas A&M University. He joins us now live from Texarkana. Thank you so much for joining us on the program today. Now, first off, do you think the use of the COVID-19 vaccine should be made mandatory?
I think the vaccine being optional is actually a reasonable approach given where the vaccine is right now. If the vaccine is approved, as it was in the UK, it will be what's called emergency use approval, which is really meant to be a temporary measure that allows for sort of ongoing scrutiny and ongoing research. And then there's a sort of a rolling reapplication and reapproval process that would go on. This is many steps away from being something that would be made commercially available to everyone. And it's something that can only happen during an emergency, like the one that the US is facing right now. So I think the situation may be a little bit different once the vaccine is fully proven, and if it is as successful as the early claims seem to be. But until then, I think this is a reasonable and measured approach. And the fact is, there isn't going to be enough vaccine to go around to everyone who would like it. At least in the early days, they're saying that there may not be vaccinations outside of people who are already healthcare workers until perhaps the summer, even if the vaccine is approved in December, as is speculated.
Right now, President-elect Joe Biden has vowed to do everything he can to combat the virus. And I can understand not making the vaccine mandatory because of the reasons you mentioned and because it's been a topic of debate for years on years. But why not make masks mandatory, especially when we're seeing a rise in infections? What types of nationwide mandates does Biden need to impose?
I think I would agree with you there and say that mask wearing does probably need to be mandatory and need to be enforced. Nearly every state, county, and jurisdiction in America has some kind of mask policy, whether it is mandatory or whether it is voluntary. But in many places, these policies are not being enforced. And frankly, looking at the numbers, where the US set another record for the most cases in a country in a day, it appears that what we have been doing has not been working. The measures we have been taking to slow down the virus have really not been effective. And so it's a question of changing up the methods or changing up the way in which they are actually applied. And that's more a political question outside of science, but from a scientific point of view, I think either one of those approaches could bear fruit. It just depends on which one can be implemented more thoroughly and more quickly.
Right, Professor, I want to now get your expertise on the Pfizer and Moderna vaccines that will be used in the U.S. How have these vaccines been developed differently from previous vaccines we've seen and used?
Yes, they're very interesting vaccines. They're a thing called a messenger RNA, which is a little bit less direct than some of the vaccines we would be used to. Most people, when they've had a childhood vaccine, have taken something like an inactivated polio virus or a broken up but still complete influenza virus as the flu vaccine. These coronavirus vaccines that are being considered right now are all quite different from that. They don't involve the entire virus at any stage in the production of the vaccine. It's only one little piece of the virus, and so a lot of the safety problems that we've had with other vaccines just pretty much disappear. This is an injection of an essentially inert substance. It's just a message that then allows the body to make enough of the right proteins in order to train its immune system in the safest possible way. With vaccines, it takes a lot. You have to really push the immune system to get it to recognize a virus and make a long-term effect. And I think what we see in the vaccines that are being considered is a range of potential effectiveness and a range of potential side effects. And I think these vaccines may be appropriate to different age groups. Essentially, there's going to be a vaccine out there for everybody. And in time, if more than one is available, I think it may pay for each of us to have a mixture of different vaccines, perhaps one in the winter and a different one in the summer, in order to get as broad a protection as possible against COVID-19.
All right, Professor Benjamin Neuman, thank you so much for sparing your time and joining us here on Tier 2 World.